Thank you. Yeah, thanks for having me. Excited to be here this early evening here in Michigan. Talking to you a little bit about Spectrum Health transition to continuous listening and really our continued journey to a continuous conversation model. I'm Brian Sniokaitis. I work in human resources at Spectrum Health. Work very closely on our engagement program, including our engagement survey. So I'll talk a little bit about why we started surveying more frequently, some of the tactics we found over the last few years from teams that have shown improvement in engagement, kind of how we've pivoted this program during COVID-19, and then talk about a couple of the challenges that we've faced in serving more frequently and how we've overcome those. But just real quick, a little bit about Spectrum Health. We're an integrated health system based in West Michigan. We've got 31,000 team members. We're a $7 billion enterprise. We've got 14 hospitals spread across West and Southwest Michigan. Our main medical center is in Grand Rapids, Michigan, and includes a children's hospital. And then we've got a number of ambulatory sites and clinics and surgical centers. We also have a health plan that serves over 1 million members throughout the entire state of Michigan. So why did we shift our engagement approach? 3-4 years ago, we were in the middle of a period of a lot of change for our organization. We were in the middle of a electronic health record implementation. So for those not in healthcare, that's a huge deal for clinicians because they're in that system all day. So changing it is a really, really big deal to your frontline staff. We had a long-term CEO who had announced his retirement. Along with that came a new leadership team, new mission, vision, values. We were moving a lot of our services to centralized shared service models. So with that came restructures and new policies and procedures. So that was those were just like the 4 big things. On top of all that, just the constant change that healthcare in general was experiencing. And we knew engagement would matter a lot during this period of big change. We believe the research that's out there that shows engagement can lead to these better outcomes, and most importantly, we know highly engaged employees can have better outcomes for our patients. But at the same time, we knew our old program just really wouldn't be up to the task of really helping us get through this period of change successfully. Like a lot of other organizations, we were serving every 2 years, maybe every 3 years, not really a lot of stability on how often we were doing it. We'd have this really long lag between the survey and actually leaders getting data. We'd extend those response time windows because we were worried because we wouldn't survey again for another 2 or 3 years. So this process would just really just keep going. It was really complex, a lot of bureaucracy, who would get data when, lots of HR work and dealing with the file and the data and putting together decks, really complex action planning that no one was doing. And all this would just be almost immediately out of date. So much time would pass by from when we launched to when frontline leaders actually got data that the organization had changed and people no longer really cared about the data. There just was not a lot of incentive to action plan. I wasn't working on the engagement program at the time, but I was in HR, and I don't remember ever hearing about results from my own team, let alone action planning, right? So we weren't even doing it within HR. So we took a new approach. We partnered with Glint, who you just heard from, to implement their product. And in addition to the technology piece, we really changed our overall approach. So we're checking in a lot more frequently. We're surveying engagement quarterly. We're also surveying across the life cycle, so we're doing things like onboarding and exit. Now, surveying more frequently allows us to really pinpoint problems before they become much more serious problems, right? So we can see something and then a quarter later see if what we did improved or didn't improve what that issue was. It also allows us to be a lot more nimble. We can change our questions a lot more easily based on our business needs and then in just a quarter, get trending information on those questions. So a lot different than surveying every 2 years or 3 years. We also allow team members to provide comments on every question. This allows our team members to describe and articulate kind of why they're answering the question a certain way. Really provides great color and nuance to our local level leaders and also to our executives on why our workforce is feeling a certain way about certain topics. And then finally, another big thing is we give leadership access to the results, and we give those survey results the day after the survey closes, right? So as soon as the survey closes, next day, leaders at all levels of our organization have access to their data. Gone are the days for us of tiered and certain levels get access to data quicker. We think that's really important. We want the results of the survey to be in the hands, especially of our local level leaders, as soon as possible so they can start taking action on those results. And so what this new process has allowed us to do is really get to some really real-time insights. And so because we're surveying every quarter, we quickly amass these data points. So each column here is one of our surveys, and this is really just kind of the first year and a half of our journey. And with some of the reports that we pull out of the tool, we're able to do things like these heat maps and at all levels of the organization really start to see, where are we making improvements, where are we steady, what are some of the things that we've slipped in or really need to focus in on. Really allows us then also to see that change over time. The other really important thing that we utilize the tool for is not only to look at the scores of the questions, but also to see how those questions that we're asking on the survey, those drivers of engagement, how they're actually impacting engagement. And so we're not just necessarily working on the lowest scoring questions. We're really trying to drive teams and leaders with these types of reports to work on questions that both have opportunity for growth in the score, but also have very high impact on engagement. Because really we want these teams to be working on things that are going to improve overall engagement. So again, we do this at all levels of the organization. We're looking at this at the company level, at our divisions, and then our teams also have access to this type of data at the team level. So with this transition to this new continuous listening, continuous conversation model, really needed to reset leader expectations. And this is really kind of the 4-step process that we lay out. So, it's more than the leader just reviewing the results. We really then need them to then share the results back to the team, get more feedback. So really that's where the conversation comes into play, right? We want these surveys to be a springboard for more conversation. And then out of those conversations, we want to see some action taken. Hopefully the team is taking action together. Again, we've been doing this now for 3 years. We've seen leaders becoming more curious. They're feeling more empowered to take action at the team level. They're becoming more adept at listening to their teams and more likely to check in because we've got these fixed survey points. It kind of becomes kind of an anchor to have these conversations, and we're building that habit over time. Now, about a year and a half into our journey, we looked at the data, looked for teams that had made some significant improvement in engagement, talked to leaders of those teams. I thought we might find some sort of, super secret sauce that they came up with to get these big improvements. What we kept hearing over and over again, they just were following these 4 steps that we had laid out. We just kept hearing the same thing over. They were following these 4 steps. Now, they were doing it in their own unique way, right, based on team size and the types of jobs on their team and whether they were a 24/7 operation or more office staff, right? They figured out how to insert these steps into their own world. But in the end, they were just doing what we said, and they were doing it consistently. On the flip side, we've also, in the data, seen some teams where maybe they made some good progress at the beginning, right? Maybe our first year, and then they plateaued or started to slip. A lot of times when I've talked to leaders of those teams, what we found is those leaders were doing a great job at reviewing the results, and then they were skipping right to taking action. And early on, they were able to find some of those quick wins in the comments and in the data, and they were able to take action on them, and people were happy, right? But over time, they ran out of those quick wins, right? And the team started to get frustrated because they're not hearing about results, they're not hearing about action, they're not involved in the process. So really found, really again, like for sustained long-term improvement, we really need all four of these steps to be successful. One area we've seen some really great improvement is with our physicians. And so we've seen some really intentional, dedicated work come out, springboarded from the survey with this group. Our leadership really embraced the scores and the comments from the initial surveys for our physician groups, which, to be frank, were not great, and took additional steps beyond the survey, right? And so really took it from a survey to a full kind of listening strategy. So they did things like launched a physician leadership academy to build the leadership acumen of our physician leaders, launched a performance mentoring program to have a structured feedback program, increased communication, but did it in a way where they figured out, well, how do the physicians want to be communicated to? How often? What kind of methods? And then I think one of the most important things is they launched these listening tours where our executives traveled physically to our physician groups and met and talked with them, right? Had those conversations, heard from them, and gained their feedback. And so I think that's really, those steps I think are really attributable, the success we've seen is really attributable to those steps. Increased participation with this group, increased engagement, so that ESAT, how happy are you working at Spectrum Health? That's our key engagement indicator, right? And then some really big increases in some of those scores. You know, I think the feedback is 13-point increase is directly related to that formalized performance mentoring program. In late March, we were getting ready to plan for our April engagement survey, and really quickly realized we needed to shift our strategy. The work effort in the organization had changed in such a pervasive way, all to planning for an expected surge of patients in West Michigan due to COVID-19. Almost all of the work just stopped, right? Our clinics were closed, elective surgeries were canceled. All effort was on planning for this surge of patients. And so we paused our April engagement survey and replaced it with a really quick 3-question pulse around support in our COVID-19 response. Because our leaders and our team members have built that habit of, expecting, what the email looks like when they get the survey email, how to take the survey, for leaders, how to get into the tool and look at the reports. This is a really easy shift for us. It was a shorter response window, but we saw incredible participation, one of the strongest response rates we've seen from one of our surveys. And the comments were just off the charts. We had more comments per question than we've ever seen. This is when we really started to see differences in our clinical staff and other frontline workers and our office workers. So our clinical workers were starting to exhibit themes of stress and anxiety, concerns about childcare, concerns about redeployment, how they were redeployed, where they were redeployed to within our hospitals. On the flip side, at the time, our office workers had moved to full-time remote work, had only been doing that for 3 or 4 weeks, and were having a really great experience. So we really started to see differences in our different populations. One really important thing that we've been able to use this data for, based on the comments, is to rethink how we would potentially redeploy workers in the future in another crisis situation. So we got a lot of great feedback from employees about how they experienced that redeployment. Now, Same thing we do with our engagement surveys. Survey closed, next day, results open for leaders. That was really, really important. Things were changing so fast at this time. If we had waited just a week to get the data and the comments in the hands of leaders, the situation would have changed so much that data, those comments would have started to already to become stale. By the time we closed the survey, we had really started, the surge that we thought was coming had our model shifted that, right? And we thought instead of a spike in patients, we're going to see more patients sustained over time. And so the work effort really shifted from planning for a lot of patients all at once to more of a long-term COVID-19 response strategy. And we heard from leaders that this, even though this was just a 3-question quick pulse, that this is really valuable. I heard from leaders who said, I thought I really understood the needs of my team. I thought I was providing them the support that they needed, but through the survey, through the comments, I really learned there's at least a couple of people on my team who really need some additional support during this time. We've transitioned back to our engagement questions, but we're now asking a new question in our engagement survey: how are you doing? We think this is a really powerful question to really ground our survey around support during this time, during this global pandemic, where we're asking our frontline workers, asking so much of our frontline workers. And again, because we're surveying frequently, we've already now got 2 data points on this question. So we can use the reports to start to see not only hotspots of high scores, low scores for this well-being question, but also start to see if we're seeing certain pockets of the organization increase a lot or decrease a lot related to this question. And again, seeing really great comments come out of this, both, again, what we can use at the organization level to modify our support, but also at the team level. And just a lot of great comments of people just, commenting, thank you for asking, which you wouldn't necessarily expect in a survey, right? But people are appreciative, right? They're appreciative that we're asking, how are they doing during this time? So what are some of our challenges been in this new model of serving much more frequently and expecting a lot, frankly, on our leaders, right? So to actually do something with these results and have these team conversations, not once a year or once every 2 years, but quarterly. One thing is, we really found our leaders really need to be on top of acting on the results, and really we found we really need to be prescriptive with them and proactively tell them you need to schedule time on your calendar, right? You need to block time off to review the results on your own, and you need to protect time on the upcoming team agenda to talk about results. What we found, if leaders don't do that, by the time our survey closes, there's only 2.5 months before the next survey. That time just goes right on by, and the next survey comes. And that comes to the next challenge is the team members need to feel heard, right? And so, with a survey, if you're only doing a survey every year, every 2 years, I think you sometimes get the benefit of having enough time go by where when employees are taking the survey the next time, it's a little bit fuzzy around, well, what did we do with that last survey? When you're serving more frequently, certainly quarterly, team members are going to remember if the leaders shared results or they didn't, right? So that comes back to leaders really need to be on top of doing something with the results. If not, team members are either going to stop participating, we're going to see reduced response rates, or they're going to make it heard in the comments, right? And we ask a question, I believe meaningful action will be taken as a result of this survey. We can quickly start to see where team members are feeling like that's just not going to happen. For HR, we found really need to focus on the data that matters. Because we're doing this quarterly, we're getting a lot of data, right? A lot of trending. If we don't focus in on areas in the organization that need improvement, or some of the things that are tied to our organizational priorities, we just get into PowerPoint land, right? Where we're just creating PowerPoint deck after PowerPoint deck and just updating it quarter after quarter, with a lot of times data that's really not changing much, right? So we really have made an effort to refocus in on what matters and really what we want to communicate back to our executives. And then finally, one thing we've kind of learned for everyone is to really look at the results over time, right? It can be really easy where if you're serving quarterly, you getting those quarterly results, it can feel like you're not making progress as a leader or as a team. But what we've really learned to do is have the leaders take a step back and look a little bit further out, right? And look at the trend line over time. And where it might not have felt like you were making a lot of progress, a lot of times leaders will see there's one or two questions where over a year and a half, they've increased that question quite a bit. In the moment, from quarter to quarter, it might just be a point. Maybe the next time it's steady. Maybe the next time it's a point. Maybe it slips at one point down. But over time, those leaders can see and share with their team that they've really made some really great progress. So yeah, if we have any time, happy to take questions. As you can tell, I really love talking about this stuff.
Hey, Brian, a great job. I really am impressed by a lot of things, and I can't get into each one given time, but I will say this. It seems like you began this with the end in mind, and I know it's somewhat cliche, but it's often overlooked, is that you did not want to start asking these questions certainly at a level of frequency in which you did, unless the organization was prepared to take appropriate action. So embedded within that, correct me if I'm wrong, is that you needed people in the room who were not only the right people to take action, but you had to ready them to get things done. Because to your point earlier, if people put their insights and energy and perspectives in this survey and related activities and nothing happened, that would suck. That would be, and being in the business is a disengager. So what did you do to set the table?
Yeah, I mean, I think there were a couple things. I mean, I think one thing is we didn't have to do a lot of convincing with our senior executives to immediately go quarterly, right? So we had that advantage, and they had bought into it, that this was going to be valuable, right? And so, and it wasn't like we weren't fighting against that. The other thing that we've really seen success in is kind of that senior level role modeling, right? And so we really try to get teams at all levels of the organization to do those same 4 steps, right? So we really want, even if it's an executive, we want that executive to be talking with their team of 10 directors about their own survey results. We've seen a lot of success there in that role modeling, and then the rest of the organization can see that this is important at all levels. Because we can talk about it all day and say this is what you should do, this is best practice. But until our local level leaders start seeing it done by our executives, that's, I think, for us when it really became real.
Well, again, congratulations on what you've achieved there. How can listeners, viewers learn more about you and what you're doing over there?
Yeah, just feel free to reach out to me. I'm on LinkedIn. I think my profile is connected to the system here, and happy to talk with anyone else. Talk with anyone about our journey and give my own insights.
All right. Well, Brian, again, congratulations on what you've achieved there. I look forward to hearing more from you in the future. So you be well, yeah?
Thank you. Thanks so much.